It's so much more than just the manual technique aspect of it. And we should be defined by that. And I think partially what I think I liked, again, going back to Silvernail's work, is I think we're moving away from just saying that we're manual therapists. Like, it's orthopedic manual physical therapists. The whole thing there is what I've been trying to tell myself to say to people, and what we're trying to brand in our fellowship. This is OMPT, not MT. And I think that's that delineation. And in fact, like, if I could change something, I might say orthopedic and manual physical therapy, and say, because I agree, like, orthopedic has a very understood approach when it comes to patient care. Patients understand orthopedics. They understand like who you go to and why you would go to that. And then the manual therapy pieces we've talked about has its positives and negatives. But I also, Mark, I don't really know if there is a term that patients truly resonate with. That's honestly probably a good research project to say, hey, if we go out and survey 500 PTs or patients, what would they say? If they could pick a name, and you could even look and say, let's look at somebody who sees a fellow in manual therapy and orthopedic manual physical therapy. And what is it that defined that care? What was a word? Even just think of like a word cloud. What are the things that resonate to them? And I think that's the question. Is I think we're looking at this as a clinician-centered name change potentially. And we're not looking at, like you said, this branding thing is like, what are our stakeholders and our clients think? And so I think that's the question.